Dr. Moffic. I'm a psychiatrist and member of the editorial board of Psychiatric Times. And this is a special video having to do with our upcoming 250th anniversary of the Declaration of Independence, which is called, if I can get this out right, sesquicentennial. And the question, as far as the Declaration of Independence goes, is what's independence mean, both for the country and for psychiatry, and really freedom. I've developed in thinking about this, there's been so much attention to this 250th year anniversary from all kinds of fields, politics, law, entertainment, tourism, etc. But there's been virtually no attention paid for it within psychiatry, or really, as far as I can tell, mental health in general. Yet, if you think about it, it really is so important to mental health. You could probably say this is a declaration of mental health, and also important for patients. So how do I basically mean that? When we talk about independence, as far as our psychiatric patients, I think it's obvious that their independence is compromised by their mental illness, whether that's a full-blown psychiatric disorder, PSD, depression, anxiety, schizophrenia, bipolar, or whether it's something more mild, like, well, I don't know if I'd say mild, but burnout and moral injury and loneliness and cultish thinking. All those things reduce our independence in our patients, and then we have stigma added onto it. So independence is really important for psychiatric patients. For our government and our country, it has to do, of course, with our separation from Great Britain. But it's interesting. I think our country emphasizes independence for individuals. And that's a little different than other countries, such as Canada, for instance. Even France. I think France has three items that are, if I get this right, peace, liberty, and fraternity, meaning brotherhood. It puts in others, but the United States really emphasizes individuals, for better or worse, perhaps. It just has a different emphasis over time. So that's a long-winded explanation. I guess I would summarize it by saying we could even look at psychiatrists as freedom fighters of the mind. Obviously, our country started by freedom fighters for independence, external forces, but we also have our internal mind that needs freeing up as much as psychiatrists can contribute to it. So that's how I would look at the whole meaning of this holiday for psychiatry. Again, it seems like we, as a field of psychiatry, haven't paid much attention to its meaning and importance. So the opportunity to do so is really helpful. And I hope it'll elicit some discussion in various places, whether that's in the APA caucuses or people's response to this video, whatever it may be. I think we need more discussion about how important it is and what we as psychiatrists can achieve positively out of this very special holiday, because changes are going to be increasingly rapid now, and we need to prepare ourselves and try to make the best of them for ourselves, for the public, and for patients.